Blazing Hot 91, the Blazing Hot Morning Show. Good morning to you, 757. It is Wednesday and January the 13th, 2020. We always pause on a Wednesday for a segment we call Health, Healing, and Hampton Roads. Now, today, we're going to be talking to the American Red Cross because it is Blood Donor Month. And on the line, we have the Executive Director of the American Red Cross Coastal VA, Michelle Ellis Young. Good morning.
Good morning, Doug, and Happy New Year. Glad to be with you.
Yeah, glad to have you back on the show. You have joined us one time before. Now, you're a native of New Orleans, Louisiana, as well as alumnus of the University of Houston, Hampton University, West Virginia University. Ordained minister, serve on several community boards, committees, and ministries. So definitely welcome to your role, even as the newest executive director for the American Red Cross. So welcome back, Michelle.
Thank you, Doug. Today is my 1-year anniversary at the Red Cross, so what a great day to talk to you.
Yes, indeed. Happy anniversary to you, and thanks for coming on the show. Now, let's talk about the American Red Cross real quick. Let's just give a history background so that people, we always see that Red Cross symbol. Tell me exactly, what is the American Red Cross?
Well, I'll be happy to share that with you. Our mission has remained the same over more than 140 years, and that's simply to prevent and alleviate human suffering in the face of emergencies. And we do that by mobilizing the power of our volunteers and the great generosity of our donors. We are a trusted partner for so many entities across the United States and internationally that allows our communities to know that there is, as your show is, help, hope, and healing in the times of crisis.
Mm-hmm. Indeed. And when there's a time of crises, how does the Red Cross come in and serve the public?
In a number of ways. Through our blood services, we provide almost 40% of the nation's life-saving blood supply for individuals who find themselves in trauma, whether they need a transfusion due to accidents or our people of color with sickle cell. You know us a lot from our disaster services, so whether there's that hurricane or tornado that hits and disrupts people's lives, but 90% of the work we do under disaster is in local communities every single day through home fires. We're also one of the premier providers for CPR, AED, and first aid training, and so we want to make sure that there's resiliency built in our communities in case something happens right in front of you. We want people to feel empowered that they can help in that moment until a first responder arrives. Mm-hmm. And then we provide that support to our services to the armed forces in the time of need. We're the first line of communication to get that service member or their family member the information they need for what's going on the home front, and if necessary, get them back safely to their home to take care of whatever that emergent need is. So we're a busy organization, doing lots of great things to help our communities every single day.
A lot of different branches going on there. So it takes a lot to lead that particular organization. Man, that's a lot going on. Now, January here is National Blood Donor Month, correct?
It is.
Now, tell us about, Blood Donor Month, and how do we go about the process of even giving blood, and what does that whole process entails?
Blood Donor Month is relatively new. I believe it was actually penned by Nixon and signed as a time to really reflect on those that have walked the journey with us and so many other organizations to provide blood to the community. So it's just a way to recognize those that have donated, as well as to inspire those who might have considered but have not done so. And so during this month, we are doing what we do every day, collecting blood, platelets, and plasma to ensure that our communities have what they need. Now, the process of donating blood is relatively simple. If you are in this COVID environment, a healthy individual, we certainly want you to present yourself. So you go to redcrossblood.org or contact us at 1-800-RED-CROSS if access to the Internet is an issue, and reserve a spot. You can find a spot probably anywhere near you every single day of the week. You make that reservation. When you come into one of our facilities, we will follow all of the CDC protocols to ensure your safety as well as the safety of our team members. So we temp, we sanitize, we clean, we check, we re-temp, all of those things. But the experience itself should really, for blood donation, should take really no more than 25 minutes.
Okay. All right. Gotcha. Walk us through those steps. What do I do when I first come in? Because this may be a first time for me, trying to give blood. How does that process look?
I love first-timers because first-timers ensure the pipeline, right? So you walk into a facility and you are going to be greeted by a great smile of gratitude from one of our partners or our employees who are there. They'll immediately make sure you're masked. And if you're not, they provide that to you. They will temp you to ensure that your temperature falls within the guidelines. Once you are temped, we have a seat reserved for you if a phlebotomist is not ready to check you in. Once you are ready to be checked in, they go through a screening process. Hopefully you've done what we call rapid pass at home. That makes a lot of this a lot quicker. And then they go through retemping again, checking your iron counts, et cetera. There's a process that they go through, some questions. And if you're cleared, then we have a bed that's reserved for you. And that is at that time, they begin the process to draw blood. If you're anxious about that experience, don't be. They're trained professionals, and not only trained professionals in drawing blood, but they're trained professionals in compassion for people. And so rest assured that our team members have your best interest at heart. They're going to walk you through that process with ease and to reduce your anxiety and just encourage you and champion you along the way. Once you're done, you get some snacks. We allow you to sit down just to make sure you're okay. And you might even have a group of cheerleaders who are just clapping and yelling because they're excited that you did it. So we're partners in the donation process.
And you said two things that I want to just separate. You said being a blood donor and then being a plasma donor. What is the difference between those?
Now, the plasma is a different experience. That's going to take a few hours of your time in your day. And I'm not going to go into the medical perspective of what that plasma is. But that is another way of blood extraction. And I will say this to you, Doug, that is so important to our donation process in the COVID environment because plasma from those that have a medical diagnosis of COVID and have recovered from that diagnosis are able to donate plasma that ultimately might save someone's life who is battling COVID right now.
Okay.
So we have a critical need for those that have recovered in a healthy manner from COVID to make sure they contact us. Now, of course, there's a stringent process through CDC that we follow, but if you are cleared to be able to present, we highly encourage those individuals to step forward and help other citizens who are in the fight for their lives right now.
I was listening to one of the national programs, and they were talking about blood is starting to be in shortage because of COVID-19, and they were encouraging people to give during this time because they were seeing an all-time low.
That is absolutely correct. You know, when communities start to lock down in a number of ways, with businesses still closed and schools and universities closed, a lot of our faith-based communities closed, and other partners. When people have to retreat back to their homes just for safety reasons because of this virus, how they do other activities is greatly impacted as well. And one of those is the donation of blood. And there's some, there's no secret that there is some angst, with people in this environment and doing anything in a procedural perspective. But all I can tell you is to rest assured your American Red Cross, no matter where you reside, is doing all that we can to ensure that safety and well-being for our communities to be able to present. Because if the blood supply shortage diminishes, we are in trouble. Just imagine if you were on your way to the grocery store and unfortunately there was a tragic accident and you needed a blood transfusion and that blood is not readily available in your community. We have to go look for that blood. Imagine being a sickle cell patient who is in crises and there is not a supply of blood that matches your likeness in our communities. We have to go find that match for you. And that could take a while. And so when our communities respond, they're helping to ensure that the blood is where it's needed most. So we just encourage people to remove the fear, ask the questions, contact us. You can contact me directly. And if I have to show up to a blood drive with you and hold your hand, I'm willing to do that because it's just that important.
Mm-hmm. I hear you. Go ahead and give, where we can find out more information about a blood drive near us.
Absolutely. You can always go to redcrossblood.org, or, again, if Internet access is an issue, contact us at 800-RED-CROSS.
All right. That's 800-RED-CROSS, or go to, redcross.org?
redcrossblood.org.
Blood.org.
Specifically for, yes.
All right. Well, Michelle, thank you so much for coming on Health Healing in Hampton Roads. As always, I've enjoyed this segment. You have enlightened me so much as far as the need, especially during COVID-19.
Thank you, Doug. It's always a pleasure to be in like-minded company.
There you go. It's Blazing Hot 91, the Blazing Hot Morning Show. Make sure you go to that website and check it out because we need to support the 757. Tamar Braxton, if you don't have you, it's Blazing Hot 91.